Can you guys hear me?
I can.
Yay.
Yes. Yes.
Okay.
Yes.
Yes.
So I'm going to feed Kai right now. Since he's not a tube feeder, I'm just going to go ahead and feed him. But I'm going to put him on video for you guys.
Hey, Emily,
Yes.
I'm gonna make you the host. That way you're the main screen for everybody. But I'll
Okay.
still be helping if you need anything.
Okay.
Okay, so I'm gonna do that real quick.
Trying to figure out how to turn my screen around, my camera around.
Oh.
From last time.
Wish I could tell you I knew how.
I found it.
Okay. Hey, Jeff.
Yes.
Right. Don't climb out, please. He's gonna jump. Stay in. Stay in. You're 6 feet up, dude. Does anyone know if I can minimize Zoom on my phone in order to look at my notes to make sure I hit everything that I want to talk about?
Yeah, you should be able to just, what, do you have an iPhone?
No, it's a Google phone.
Okay, then I'm not sure how you do it, but I know on an iPhone you can. You can just pull up another window.
Okay.
And she can minimize her Zoom so she can look at her notes. But it's on an Android. Yeah, I'm not sure about that, Emily.
Okay. Oh, we're So Kai is eating all of his feedings on his own. He won't like suckle. He keeps his mouth open. I don't know if his mouth still hurts, but he'll take it if I push it in.
Hey, Emily, somebody just typed how to do it on your phone.
Oh, okay.
So once you're done there, it's in the chat.
Okay. Wasn't very much food. I'm gonna give it a few more minutes to make sure everyone's on.
How old are these babies?
They're both 4 weeks.
Oh,
They're 1 day apart.
oh my gosh.
Kai the kitten, I don't know if everyone read my stories about them, but Kai
Yeah.
the kitten came from a house fire in Detroit. His mom died, his sister died, and he ended up with me for tube feeds and oxygen.
Oh, that's the one. Okay, I did read that.
Yeah, he took, I don't know what his deal was with feeding. Took forever to start actually allowing anything in his mouth. We think maybe he had some
Like
smoke burn.
oxygen. Oh, I was thinking oxygen deprivation, like something to with the brain.
Yeah,
Is that possible?
he definitely, well, he had carbon monoxide poisoning and smoke inhalation, which apparently most animals in general don't survive that. They do okay for like 24 hours and then most of them pass.
Mhm.
So my vet is thinking he probably had a sore throat.
Oh, so it hurt to suck.
Yeah.
Yeah.
He stunk so bad, like you could smell him through the house. It was
Wow.
insane. He was like, I don't know, 4 or 5 ounces when we got him, and you could smell it through my entire
Oh my
house.
gosh. Poor little guy.
I've washed him a few times since he's been here, and you can still smell it sometimes.
Wow.
Yeah. I don't know how he survived. I have no
Jeez.
idea.
Tough little boy.
Yeah. And the puppy is a cleft palate baby. She came to me at about 2 days old also.
My goodness.
Working on kibble. She doesn't take it on her own, so I'm putting one piece in at a time and she eats it. She loves it.
Aw.
She's way smaller than her litter mates. She's a fat, solid little thing. All right, I'm just gonna give her my little handful of kibble and then I can start with her, with the puppy.
Okay, I'm gonna mute myself again.
Okay. What are you doing? right. I'm gonna put the kitten on the floor for a minute. So, tube feeding. Okay. I guess I'll start with the tubes themselves. I use mostly size 5 French. Everyone kind of has their own preference for that. I just find that to be a good general size for most animals that need tube feeding. I've used as little as a 1.8 French, which is teeny tiny. Like smaller than you even need for kitten preemies. Hang on just a second. Let me go grab his tube actually before I get into this. Okay. So I usually use size 5 French. Preemies, I tend to use like a 3.5 or a 4 French. They're super tiny. You need your formula mixed as best as you can because they get clogged pretty easy. Bigger kittens, I'll use up to like a 7 French or an 8 French. All of these tubes I usually get from a website called squirrelsandmore.com. I love their tubes because you can use regular syringes on them. Some tubes don't fit your regular syringes that you use for like injections and stuff. So I like their tubes. They're clear, so you can see the milk going through, and they have markings on them so you know how deep to go. They're measured in centimeters. I can send a list of, or I can send links actually to the group chat afterwards if you guys want links to any of the supplies I mentioned. Just go ahead and comment in there if there's anything that you want to link to. So one of the biggest things I hear from people about why they don't tube feed or why they haven't learned is because a lot of people are afraid of going into the lungs. It's actually really hard to get into the lungs. That's it's a super hard angle to make to get into that hole that goes down into the lungs. So if you basically the airway is in the front of your throat and your esophagus that the food goes down is in the back of your throat. So if you angle your tube to the back of the throat, which I'm going to show you, it's almost impossible to go into the lungs. When you put your tube down, one method that people use to make sure they're in the right spot is to pull back on the syringe and see if you get air. If you get air, you're probably in the lungs, but not always. If you get resistance or you get fluid or milk or something, then you're in the stomach. So in order to measure, can you guys see this? The measurements on here at all? I can't tell if it's in focus. She knows what the tube is for. So there's little tiny measurements on here. You probably need your magnifying glass. But in order to measure, puppies and kittens are the same. You're going to measure, hopefully I don't block the camera here. You're going to measure from the nose to the ear and down to the bottom of the rib cage, down to the last rib. That's a lot further than I thought it was getting. Hang on. So nose to ear to the bottom of the rib cage. And she's grown. So she measures to 15. The bottom of the rib cage is right where their stomach sits. If you go too far, it'll curl in the stomach, and mostly that's not an issue. But if you're using a larger, stiffer tube, you can actually poke through the stomach. So be careful how far you go. You don't want to go too far beyond the end of the rib cage. If you don't measure deep enough, the biggest risk you have is that it's in the throat. And if you feed while it's in the throat, there's a risk of it coming up the throat into the mouth, and they can aspirate. And that can happen even when you're in the stomach. So you always want to push your food in slow. Hi, puppy. And I'll show you measuring again once we get to the kittens too, but it's exactly the same. Oh. So tube feeds go on the same schedule that they would be on if you were bottling. So mostly I do every 3-ish hours. Preemies I'll do every 1, sometimes every 2 hours. It depends on the kitten or puppy. But most of my, she's going crazy. Most of my tube feeders are on a 3-hour schedule around the clock. There's lots of good charts out there to tell you exactly how much they need to grow. It mostly goes by weight. Some of them go by age, which I really don't love those charts because if you have an emaciated kitten that's say the size of a 1-week-old at 3 weeks old and you're trying to tube feed the 3-week-old amount, that's a huge amount for a tiny kitten. So I go by the weight charts. So before you put your tube down, connect your syringe, obviously. Push your formula through your tube so you're not pushing a bunch of air in the stomach. I push it right to the end of the tube until it drips. If you forget to do this, it's not a big deal. You just might have a burping kitten. So when you put your tube in, this puppy is great with her tube feeds. She doesn't need to be wrapped. She doesn't really need anything. She almost kind of sucks her tube right down her throat. She loves it. Sometimes she squirms. These tubes don't hurt. They're just, they can make them gag or they can be a little uncomfortable, but they're not painful. When you put your tube in the mouth, just go all the way to the back of the throat and it's gonna kind of direct itself. The 5 French tubes I find are flexible enough for most any animal that it goes right down. Some of the bigger tubes, the 7 French, you have to actually physically angle it down because they're stiffer. But if you go all the way to the back of the throat and down, you're not going to hit the lungs. Okay, so I'm right-handed. I use my left hand to stabilize the animal. I use my thumb and my pointer finger on the head I wrap my other 3 fingers around the chest, and you don't have to hold tight for most animals. I just kind of stabilize the head this way. She's getting antsy. Girlfriend. All right. Hopefully you can see. So you're gonna go in and see how she sucks her tube. A lot of puppies are like this. All the way to the back of the throat and just thread it in. So I'm hitting resistance right now. So what you do, if you hit resistance, is you pull back. She's sucking this tube so hard. Hold on. You pull back and you try again. Resistance is usually just a valve. She's really resistant. Sometimes if you reposition, goodness, child. All right, hang on, I think it's my angle. Third time's a charm. So she can be tough sometimes. Hang on, I'm gonna grab a larger tube. Sorry, guys. Okay, so what happens sometimes as they get bigger is these smaller size tubes, she's almost a pound. So the smaller size tubes can curl or get stuck in weird places in the throat. So if you're consistently, this is beyond what I wanted to talk about today, but if you're consistently getting stuck somewhere and having resistance, trying a bigger tube can help because they go down straighter, don't curl. All right, Peanut. So I have a 7 French now. But you still, oops, you still don't want to push hard if you meet resistance. Okay. I don't know what the deal is here. Hold on. There it goes. Okay, so I keep my fingers around the chest and I use my pointer to hold the tube in the side of the mouth so that I can use my other hand to push. She's going insane. Yeah. And she just tongues and suckles at her tube. Kittens usually fight a lot more than this puppy does. So to pull it out, you literally just pull it out slowly. Some people recommend flipping them head down so that if they spit any formula out while you're pulling the tube out, it'll just come out of their mouths. I don't generally do that. but that's just one trick. If you have a kitten that's consistently puking after, you can put them head down. Any questions about this so far? I'm going to show you on 3 more kittens also. It's usually not this difficult to get a tube down. I don't know what that was all about. No questions? All right. I'm going to move you guys down to my other incubator. I'm gonna put his litter box back in. These 2 are so cute together. Okay, these 2, they pooped. Guys made a mess in here. These 2, I really have no explanation why they don't eat. This little one off to the right did eat at first when she came here, and now she doesn't really want to. But they'll suckle on each other. And this one has no excuses. She's just fat. Are you guys ready? All right, I'm going to get some pee out of them real quick. And then I'll show you. These guys are a lot easier to get the tube down than the puppies. So. Oh my gosh, you have poop in your armpit. What happened in here? Lordy. Okay, we're just gonna have to take in our armpits. It's gonna have to get taken care of, guys. You're an embarrassment. So this little kitten is Cupid. I don't trust her at all. I don't think she's very healthy. She's one of these newborn kittens that never really got mom's milk. And her GI tract is not right. She's just not a trustworthy kitten. Okay, so for these little ones, I use a 5 French for anything newborn up until usually by that point they're eating on their own. Some of them don't. And also, while we're talking about ages for this, so once you hit about 4 weeks, most kittens who won't suckle on their own or eat on their own should be able to handle syringe feeds by then, like gruel, or I don't use straight formula for that because it's so thin, it's easy for them to aspirate formula. So I'll use gruel in a syringe at that point. For kittens that should be on bottles and shouldn't be on gruel yet, I always choose, if they won't eat on their own, I always choose tube feeding over syringe feeding because exactly the same reason. The formula is so thin, it's so easy for them to aspirate it. So if you're able to tube feed and you're comfortable with it and they will not suckle, that's the safer bet. Hey guys. Okay, so same measurements. These guys are going to be hard to see because they're so dark. Same measurements. You go nose to ear and down to the bottom of rib cage, somewhere around there, which is 13. I find most newborns are around 10 centimeters, and they gain about 1 centimeter per week. So 13 for a 3-week-old seems about right. Are you ready? These guys need to be wrapped. They are wild and they have claws. I try to wrap the arms down. Otherwise, they always find a way to escape. Sorry, I know you hate this. Okay. And same thing when they're wrapped. I keep my 3 fingers around the chest and my thumb and pointer to stabilize the head. We thread the back of the throat. This is my wildest baby. She's gonna get her arms out. Here she goes. She's crazy. Oops, we went too far. Okay, so when I say you're measuring, you're going into 13, your 13 centimeter mark should be right at the lip. So that's where your pointer finger is holding the tube to the lip, should be right on the 13 centimeter mark. And then push in. I hope you guys can see this. It's, oops, she's completely out. If you see any milk come up into the throat or into the mouth, honey, either you're gonna want to keep paper towel nearby. So if it comes up into the mouth, you can pull your tube right out, stick a paper towel or Kleenex or something in the mouth to clear it. Okay, I know. And then pull your tube out. It should come out easy. If you feel any resistance, stop pulling and call your vet. Right, you feel? Some kittens are super wild like her. You just have to fight past it. It's not hurting her. She just hates it. And this little one, this little one I already measured. She measures 11 centimeters. So again, all the way back. Kittens will clamp down. Some kittens will clamp down on the tube and make it so you can't push it down. You just have to wait for them to release their jaws from the tube. I know. You feel your belly getting full? We got some air in there. And pull your tube out. Yeah. Any questions on these guys? Holy huge belly.
How much do you give them per feed, Emily?
So I don't know who I'm talking to, but
It's Lauren.
who is it?
Lauren.
So I'm a NICU nurse, so I actually use a calculation based on their weight. But there's charts out there that go by how many feedings per day you're giving and what their weights are, and you can just go across the line and it'll tell you how much to give.
I had heard that you were supposed to, I bottle feed, so I'm used to looking at the charts, but I had heard that you were supposed to feed them a little less if you're tube feeding than you would with a bottle. Is that right? Or no, you just feed them? Same
So
amount?
with a bottle, they tend to eat more on their own.
Yeah.
I find that most kittens will eat a lot more than the charts say. So the charts are actually meant for tube feeding.
Okay. Got it.
Emily, are you feeding straight formula or are you diluting it?
I'm feeding straight formula, but I do dilute for the first like 24 to 48 hours to kind of help them adjust to the formula, especially if they've been with a mom for a while. They can have a really hard time adjusting to that. Anything else for these guys? I'm
I
gonna
have a
move.
question.
Oh, go ahead.
How do you know like when a kitten needs to be tube fed versus bottle fed?
So
Because
if they're not, so I tend to go by the charts for that when people ask me. If they're not consistently gaining weight and taking enough to meet the requirements on those weight charts for the feeding amounts, then I'll suggest tube feeding. And if they won't suckle, it's mostly these kittens that just won't latch to a bottle. When I first intake a kitten, like this one, came to me at about, we think like 10 to 12 days old. She had a really hard time adjusting to a bottle. She really never took to it. She was used to mom's nipples. Kittens like that, I usually will allow up to 3 feedings missed when I first take them in because they're still adjusting. By the 3rd feeding, if they're not latching to the bottle, then I'll start tube feeding. And usually with kittens like this, she's obviously fat and healthy and active. I'll try the bottle every time before I pull out the tube. And most of the time, within 24 hours, they're on the bottle. This one just never took to it. If you do adopt that method, waiting until the 3rd feeding on intake before pulling out the tube, I do like to give a little bit of sugar to make sure they don't crash. But that's kind of how I determine. I don't like to, so when I say syringe feed, I'm not talking about when you put a nipple on the syringe and they suckle out of the syringe. Syringe feeding, I'm talking about the kittens that won't suckle and you're just pooling formula in their mouth and asking them to swallow it. The ones that you're actually pushing it in, that's what I find to be the biggest risk for aspirating. You can't climb out. So I do like to, for kittens under a week old, I like to use a syringe with a nipple on it. Let me see if I have one in here. Actually, here, this is Kai's. So I put a Miracle Nipple Mini right on the syringe, and he sucks this nipple, and I just kind of help the formula come out of it. But he's going through the motions and doing the suckling. So I like to use this for the first, at least the first 7 days, so I know exactly how much they're taking in. Once they hit about like 10 to 14 days old, then I switch to a regular bottle and let them do all the work. Any other questions? I have one more to show you. So this last kitten I'm going to show you, hang on, I'm going to move everything. This last kitten I'm going to show you is 4 weeks old, probably almost 5 weeks. And I normally wouldn't tube feed a kitten like this with a full mouth of teeth, but she is neurologically abnormal. She was attacked by a dog. So she doesn't really move. She does move a little bit now, but she doesn't move. She doesn't suckle. She can't eat. So she is kind of a bigger risk for aspiration than the average kitten, because I don't know that she can swallow without sucking it into her lungs. So I'm not syringe feeding this kitten for that reason, even though she's beyond the age that I would normally choose a tube. I have her in a diaper because last night she peed and soaked herself and got cold. So this baby, we just got her yesterday, so she's still in really bad shape. But she's going to demonstrate tube feeding with teeth. So the kitten lady this week, I don't know how many of you follow her, but she has a cleft palate kitten named Shoo Shoo. And he's got teeth now. He's old enough to eat on his own, but with the cleft, he can't. So we fashioned a bite guard, and that's where my inspiration for this came from. But this is a bite guard that I made out of a straw from a tumbler. And it's a little bit flexible. And I poked a hole in it all the way through for the tube to go through. Prop up my phone for you guys. So to use the bite guard, you just have to put it in the mouth between the teeth, and you thread the tube in through the hole. So that way, when she bites down, she's just biting the straw. She's a sad little peanut. She's actually better than yesterday, if you can believe that. So she's a bigger kitten. I've been using a 7 French tube with her. She's definitely, she could use a 5 or a 7. They come in basically every size. So I like to just put the tube through just the tiniest bit to get it started before I put it in the mouth. It's hard to balance my phone and the angle and everything. So bite guard in, you can put your fingers, instead of around the head, you put your fingers around the bite guard. And you thread your tube. Oops, her tongue was down. She keeps her tongue stuck to the roof of her mouth sometimes. Tongue down. Okay. So she's clamping down. And she measures to 14. I didn't mention that or show that. So you can just stabilize her head with the bite guard, push her feet in. And so you can see how slow I push. She gets about 16 mLs, so half an ounce per feeding. You're using your paw, good girl. And then before you pull the bite guard out, pull the tube out. Okay, good job. So that's tube feeding with teeth. Over. If you ever have a kitten like this is totally off topic, but if you ever have a kitten that's immobile like this, make sure you flip them every feeding, turn them to the opposite side. They're super tiny and super light, but they can get pressure sores. Any questions about that? Shannon, I try not to do it in less than about 30 seconds. You'll know if you're going too fast because you'll start to see it up in the throat. Dawn, I got the diapers from Chewy. I can send you a link if you need teeny diapers. Just remind me. Any other questions? I can make videos. If any of this was hard to see, it's hard for me to look at the screen and do the feeding. So if any of this was hard to see, just let me know. And I can make a separate video on tube feeding. Anything else?
And we could actually see really good.
Oh, good.
Yeah, thanks so much. That was
Yeah.
great.
Thank you. Really, really helpful, really interesting.
No problem. All right. So I'll probably give it, I don't know, another 5 minutes and make sure everyone's on for crashing kittens before I start. I'm gonna sit here and figure out how to pull up my notes. Can you see me and hear me?
Yep.
Okay. All right, so I have my notes up. We'll give people a couple more minutes. Who has kittens right now?
I do.
Probably everyone by now.
Oh,
Wow, that's crazy. Hi, buddy. This is one of my Felix. He's gonna roll on the floor. Ow.
Got any good tips for weaning off the bottle?
Um,
I'm having a
hate
hell of a time.
how old or
They're
How old
5
are you?
weeks, 5 weeks in a couple days. It'll be 6 weeks
Oh.
Friday.
are you syringe feeding? Who is this?
No, it's Riley, but no, they're
Oh.
bottle feeding really well, and they're bottle feeding slurry, but they
Okay.
just don't want any part of eating out of a bowl or a dish, or just won't
So
do it.
I usually by like 5 to 6 weeks will start syringe feeding slurry and trying to kind of direct them to the plate.
Oh,
Most of my kittens, like if you put some on your fingertip and put it in their mouth,
yeah,
and try and kind of like physically put their face near the bowl as you're doing it or the dish.
yeah,
Sometimes they'll catch on that way. They're a pain in the butt.
yeah. Jeez.
I know some people that use Gerber chicken or turkey also.
Oh, yeah. I
Say
forgot
it's
about
kitten
that
crack.
trick.
Yeah.
I have some. Okay, I'm gonna try that today.
I haven't
Okay,
used that
yeah.
trick, but I've heard it's like kitten crack. So
Yeah.
Baby food does work in my experience. Not
Yeah,
always.
I forgot about that one. I'll try that tonight.
oops. All right. We ready? So we had kind of a big mix of comfort levels. So I'm gonna go through basically start to finish, basics up to the more advanced stuff for crashing kittens. Everyone obviously has different experience and different supplies available. So I think I put this in the chat yesterday, but if there's anything you don't have access to, or that your rescue won't allow for one reason or another, just let me know and I can kind of give you alternatives if there are alternatives. So I'm going to send you guys this file I made. I turned it into a PDF of basically everything I'm going to talk about. I might want to add some stuff on before I send it to you, depending on what questions there are. But so I can send you guys a supply list. Some of you I know want to get more into like the ICU care, the really bad kittens. I'm always around. I can always help with ideas and suggestions. But for supplies, for every kitten foster, no matter how new you are or how much experience you have, every kitten foster should have Karo syrup on hand, or 50% dextrose, which is a farm product. It's used in cattle a lot, so you can get it over the counter at farm stores or on Amazon. So Karo syrup or 50% dextrose. I can send you links to the dextrose if you want. I find it to work a lot better, a lot quicker. Dude, take it easy. Karo syrup. So advantages of using Karo syrup. It's super inexpensive. You can get it basically anywhere. Even CVS carries it. If you're out in the middle of the night picking up a kitten and you need Karo syrup, you can get it basically any 24-hour store. The disadvantage is you end up with super sticky kittens, and sometimes it doesn't absorb as quickly as actual dextrose. If you don't have access to Karo or dextrose, some people use like pancake syrup, or you can boil a pot of water and put some sugar in it. It's half water, half sugar. Just make sure it dissolves completely, otherwise they're not going to absorb it. And I'm going to go more into detail about how to use this, because Karo is one of the things I found that people actually don't know how to use. They have it on hand, but don't know how to use it. So I'll talk about that. The advantage of dextrose is it's not as messy. And I feel that it works a lot quicker. And it can be tube fed in emergencies, which I'll talk about that too. Disadvantage is it's a little more expensive. I think last time I bought it, I think it was about $9 for a bottle, but that bottle will last you forever. Technically you're supposed to, can you see me? Okay. Technically you're supposed to throw the bottle out after a month, but if you keep it refrigerated and you keep it sterile, so clean the top before you draw any sugar out of it, it should stay good. I use mine for about 3 months at a time, and then I get a new bottle. I can send you links to that. So other supplies that every kitten foster should have are thermometers. I just got, I just got a basic oral human thermometer. This was like $4.99 or something on Amazon. They come in all different colors. So I have a different thermometer for every kitten or every litter of kittens, all different colors, so I don't mix them up. These give you a reading within about 10 seconds. And the tip I found on this particular brand, this was a good surprise. The tip is super tiny. So it's good even for newborns. And then the other thing I use is Dynalube. They're little lube packets meant for human medical use, for like people that need to catheterize themselves for their bladders. These are great. I actually store the thermometer in the lube on top of each incubator. So, and then every foster should also have a heat source. Even if you're fostering older kittens, like up to about 10 weeks, I try and make sure everyone has a heat source. Not necessarily to keep with the kitten 24/7, but if you ever do have a crash, you really, really, really need a heat source. So I go back and forth between my preferences, but I use Snuggle Safe heat discs, or I use a bag of IV fluids heated in the microwave. Some people use like a bag of rice heated in the microwave. That works great too. Heat pads are okay. If you buy an electric heat pad, make sure that it has, that it doesn't automatically turn off. I've seen a lot of cold kittens because of like 2-hour automatic turnoffs. And then the other thing I like to keep on hand, and this is not a crashing kitten thing so much, but Capstar or some kind of flea obliterator, I'll say. Because some of these crashing kittens are anemic from fleas. So I like to make sure every kitten, the second they come through my doors, is getting rid of the fleas. And for people who want to do more advanced stuff, I can do this separately, but I have some recommendations for incubators, blood sugar meters, if anyone is interested in actually knowing that the actual blood sugar of your kitten. I've found ever since I got my meters that sometimes when I think a kitten is sugar crashing, it's actually not. So that kind of helps you to know what you should be focusing on with that kitten. I use a lot of oxygen here also. So if anyone is interested in knowing about oxygen and which machines work well for kittens, I can help with that. And then some more basic stuff, but a little bit more than the average foster, is like bags of lactated ringers or B12, and then penicillin is also great to have on hand, which you can get at farm stores. The penicillin, a lot of people use it on intake. I always do 1 dose for anyone under 4 weeks old. And that helps with the switch from mom's milk to formula. It kind of helps balance out the gut and helps them to be able to handle the change. It prevents a lot of diarrhea. So 1 single dose on day 1. For every kitten coming in, this is kind of a little bit unrelated to crashing kittens, but I want to talk about it because this is something that would help prevent some crashes. Every kitten coming in that's under 1 pound, you should be weighing them every 12 hours until they're rock solid stable. Once that you feel they're stable and doing well, then I usually recommend every 24 hours weighing them. Temperatures also should be checked daily. I sometimes will have a kitten that I check hourly until they're stable in the incubator. If you're planning on going this far, my screen keeps turning off. If you're planning on doing like the more advanced stuff, I do blood sugars on intake on every kitten under 1 pound also. We talked about penicillin. For kittens like 1 to 2 pounds, I'll just do a weight and a temperature on intake. And if they're over 2 pounds, I just check weights every day, every couple days for them. So the very first thing you see with a crashing kitten, this is something that gets missed a lot because I think a lot of people don't realize how important these weights are. But weight loss tends to be the very first sign that a kitten's not doing well. Even before they stop eating, you'll see weight loss in a lot of these babies. So the second you have a kitten that either stays the same weight as yesterday or has lost weight from yesterday, you're going to want to start weighing them like every 6 to 12 hours to make sure that it was just a fluke and not the start of a crash. Poor feeding is another big indicator. If you have a kitten that was eating great and now suddenly doesn't want formula, bottle, whatever. that's a big indicator that things are happening inside the body. Sometimes it's just like if it's in the first few days that you've had the kitten, sometimes it's just the adjustment to formula. So I try not to panic too much right at the beginning, but if you've had a kitten that's been rock solid that suddenly stops eating, it's not a good thing. Lethargy, once you hit the stage that they're lethargic, most of the time that's pretty far into a crash. Once they hit that stage, it's usually because of low blood sugar, not always. Sometimes nausea can cause it, or if they're just infected, that can cause it. This is the point that you'd consider it an emergency, and that's when you really should be starting to check into like temperature, sugar, all these things. And then gasping, crying out, labored breathing, anything like that. A lot of people assume this is like originating in the lungs, like maybe the kitten aspirated or has pneumonia or something. But I find that most of the time it's actually a symptom of the sugar crashing. So if you have a kitten that's pink and gasping, hang on, backtracking a little bit. So if you see gasping, check what color the gums are and the tongue. If you have a pink gasping kitten, that's probably a sugar crash. If you have a blue gasping kitten, that's probably pneumonia or something in the lungs. The reason they gasp with low sugar is because that's the body trying to correct, how do I explain this? It's the body trying to correct the pH. So when your sugar goes down, you get more acid in your blood. And the gasping is the body's way of trying to fix that. So that's why you see gasping, and that's why they look like they're in respiratory distress, but it's not actually respiratory. And then pale gums is another big symptom before a crash. Kittens are naturally pale. So it can be hard to judge, but if you see white gums, like as white as the teeth, that's a really bad sign. That's a kitten that probably needs to go to the vet. It's not something you're going to be able to fix at home. Depends on what's going on, but that can either be anemia or it can be low blood pressure also. So different causes of crashes, obviously low blood sugar happens from anything from infection to the intestines not working well and not absorbing nutrients, or not feeding often enough or enough volume. So this is where tube feeding can really help prevent a lot of crashes. Low body temperature. I think a lot of people don't realize how important body temperatures are either. Once you start dropping your body temperature, the body starts burning energy trying to keep warm, which means it's burning glucose, which drops your blood sugar when you're burning through glucose. So kittens that get cold tend to follow it with a glucose crash. And then I wanted to, let's see, what else? Oh, backtracking a little bit again. So infection. I talked to my vet about this last year because I had a series of like, I don't know, 8 kittens or something crash on me and I could not get them back. So we lost a lot of kittens all in a row. And she did some research and figured out that most kittens that crash are actually infected. If you don't have an obvious reason for a crash, like the kitten just isn't eating enough, it's usually a bacterial infection, but there's also viral stuff that you really can't do anything about. The kitten's immune system has to be able to handle it, and they generally can't at that age. So sometimes these losses are just things we really couldn't do anything about. Fading kitten syndrome. This is in my notes. Fading kitten syndrome is not its own diagnosis and does not just happen. There's always, always, always a reason. So if you have a kitten that's just not growing, it's constantly cold, there's something wrong. It's not just, this isn't a thrifty kitten. There's something going on. And if you can't figure out what's going on, hopefully everyone has a supportive vet, but if you really can't figure out what's going on, your kitten's crashing and it's just not thriving, I start antibiotics. I use Clavamox a lot, or penicillin, and sometimes that's all they need to turn around. All right, so fading kitten protocol. Does everyone know what that is? Or has everyone heard of that? So, fading kitten protocol starts with sugar. Everything revolves around sugar. So, your kitten is lethargic, hasn't been eating well, you've been seeing weight loss, and now your kitten is gasping and crying and just not looking good. So the first thing you're going to want to do is pull out your Karo or whatever sugar source you have, your dextrose, and put it on the gums. So you're not syringe feeding this, they're not swallowing it, it goes directly on the gums. One of the biggest questions I get is, how do you give it if they're cold? Because you're not supposed to feed a cold kitten. Because you're not feeding this to them, it's going on the gums. You can give it even if they're ice cold, they're still going to absorb some of it. And you're not risking their gut by giving it, because it's going directly through the vessels that are in the gums. So sugar on the gums. Karo, some people use a Q-tip. I use my pinky, just the tip of my finger, and you put it all the way back in the gums on the side of the mouth. If some people like to put it under the tongue, there's a lot of vessels under there too. You can do it that way. Don't worry about it getting all over the kitten's face. Every kitten ends up covered head to toe in Karo when this happens, and that's something you can deal with later. So another question I always get about Karo, or something I always hear, is, oh, I gave Karo, it didn't work. You don't give it just once, you're gonna wanna give it every 3 minutes. And you're gonna give it every 3 minutes until your kitten is active and bright and acting a lot more normal. So this sometimes isn't just a few minutes of Karo. Sometimes it can take hours if you're crashed really hard. Some kittens will burn through all their glucose in every last bit of their body before they show any symptoms. So you're gonna have to give glucose or Karo or whatever you're giving until that whole body has been replenished of glucose. All the glucose stores need to be filled back up. Alternatives, we talked about this a little bit. Pancake syrup if you don't have Karo or D50. You can use, I talked about 1 part sugar to 1 part water dissolved on the stove. Honey, they don't really recommend because of botulism, but it's obviously super rare in processed honey. So if that's all you have, I would still use it, but that's last resort. Artificial sweeteners will not bring a blood sugar up, so don't use those. Okay, so once you give your first dose of sugar, while you're, I like to pull out my phone and put my timer on for every 3 minutes. So you give your first dose of sugar right on the gums. And while you're waiting for your next 3-minute alarm to go off, check your temperature. Even if your kitten feels warm, it's probably not actually warm. I have a lot of people who have messaged me saying my kitten's warm, it's not acting right, what do I do? And I say, are you sure the temperature is good? And they say, yeah, it feels warm. Kitten's not warm. I've had kittens I thought were warm and I checked the temperature and it's 93 degrees. You want your kitten up above 99. Technically, if you look at like the Kitten Ladies stuff or studies on kitten temperatures during the first week, some newborn kittens are only 97, 98 degrees, but if you're crashing, you want your kitten warm. I like to aim for above 99. So to warm up your kitten, there's lots of different ways to do it. I have incubators here that I will crank up to the maximum temperature. You can, if you have a heat pad, you can wrap the heat pad around the kitten with a layer in between, but wrap the whole body and do not uncover that kitten until the kitten's doing well. You can wrap a heated water bottle, like a fluid bag, like I was talking about, or a heat disc, a snuggle safe, into a blanket all the way around the kitten. Kittens, they're similar to humans, that they lose a lot of heat out of their ears and out of the head area. So you're going to want to keep the head covered. You don't want to heat too fast. And this is kind of hard to control when you're not using, or when you're using microwavable heat sources. It's kind of hard to control how quickly you warm the kitten, but try to keep a layer in between so it's not direct heat, super quick. You want to heat them over the course of like 15 to 30 minutes. If you heat too fast, this is a little hard to explain also, but if you heat too fast, the blood vessels dilate, which brings down your blood pressure. So a kitten that's heated too fast can bottom out the blood pressure. They get super pale and then they just don't do well. They drop their blood pressure. Okay, so by the time you've gotten your kitten wrapped in some sort of heat source and you've checked the temperature, your 3-minute alarm has probably gone off by now. So you're gonna want to give more sugar. Another dab on the gums. If you're using dextrose, I didn't talk about this yet, but if you're using dextrose, the second I have a kitten crash, I will draw up a syringe full. I use 3 ml syringes with a needle on it. I draw the whole syringe up and I put 1 drop on the gums every 3 minutes. I actually keep a syringe in my fridge at all times when I have kittens. It's already drawn up. So you're giving another drop at 3 minutes. By about the 10 to 15 minute mark, I usually will check the kitten's body temperature again. So while you're warming, once you hit about 102 degrees, I usually start taking away the heat sources to make sure I don't get too hot. Kittens that are crashed, they can swing both ways. They have really bad temperature regulation. And they can overheat just as easily as they get cold. So you definitely want to keep a close eye on your temperature. So those are the two most important things, are heat and sugar. You're going to go back and forth between your heat and your sugar the whole time you're doing this.
Did you say take temperature every 3 minutes, like right before you're gonna do the gums again?
No, I check the temperature about every 10 to 15 minutes.
Oh, okay, okay.
A drop of sugar every 3 minutes and your temperature about every 10 to 15. Normal blood sugar in a kitten is between 80 and 120. Most of the time when I have a crashing kitten and I check the sugar, it's usually in like the 20s or 30s. They tend not to show any symptoms until they're bottomed out, super low. If you're using a glucose meter, I'll give sugar until I hit about 150, and then I stop the sugar, the Karo. If you are using a meter and you stop giving Karo because your kitten's 150, you're going to want to recheck your blood sugar within 10 minutes. They can drop super quick, even when you get them super full of sugar and their blood sugar is stellar. They can burn through that so quick, it's not even funny. So you don't want to step away from a kitten that was just crashed until it's been a good hour of normal behavior. If you do choose to get the 50% dextrose from the farm store and you are comfortable with tube feeding, if you're having a hard time keeping your kitten's blood sugar up and they're just not acting normal, you can actually tube feed them. I usually do 1 ml of a mixture of half dextrose and half lactated ringers. I tube it to them. And most of the time that spikes them high enough and gives them enough sugar that they stay up. So, let me see, I'm looking at my notes, sorry. So some kittens take a long time to become normal again. Once they're acting normal, it's usually about a good 15 to 20 minutes after their blood sugar has become normal. It's the same thing in humans. When you have a human that drops their blood sugar, they have this hypoglycemic event, they get angry or confused or whatever. Give them a glass of orange juice. About 15 or 20 minutes later, they're much better. It's the same thing with kittens. They take a while to get back to their norm. So once you start seeing them act normal, I usually like to go a good 10 or 15 minutes beyond that with giving sugar to make sure they stay normal. So every 3 minutes until they're acting really, really, wild and sugared up. If you're using a glucose meter and your blood sugar is normal and it's been 15 or 20 minutes of normal sugars and they're still not acting right, those are the kittens that are usually infected. I would start antibiotics if you have access to them, or call your rescue, your board, whoever's in charge of the medical care, and see if you can get into the vet. Depends on your rescue, who you're working with and how that works, but so once your kitten's back to normal, so you're gonna go a good 15 minutes beyond when they start acting normal before you stop your sugar. Once that happens, I usually will sit with the kitten and just observe, or I'll check on the kitten about every 5 minutes for a good hour after and make sure they stay solid. You don't want to feed a kitten like this right away. I'll usually wait an hour before I restart feeds. When they've crashed like this, their intestines are the first thing to lose blood supply because they're trying to support the brain and the heart and other more important organs in the body. All that blood supply goes away from the intestines. So sometimes their intestines don't want to wake up right away. So I wait an hour before I feed. When I do restart feeds, I usually will water it down and add some dextrose or Caro. So they get all the sugar they need, but not a super rich feeding that might be hard for the intestines to handle. For formula feeders, I'll usually do formula, 1 scoop of powder to 3 scoops of water. And then I add a few mLs of dextrose in, or a big glob of Caro into my mix for the day. I mix 24 hours worth of formula at a time. What else do I have here? Restart feeding slowly. Heat. So don't wean your heat too quick. So the temperature issue is super hard to manage because they get overheated so quick, and then you take away some heat and they get cold super quick. So if you're using a heat disc or a heated fluid bag or something, what I usually suggest doing is putting an extra layer between. If your kitten's starting to get too warm, put an extra layer and just keep doing that until they don't need all the extra anymore. Let's see, what else? So keep in mind when you're doing this, some of these babies, especially the younger ones, they just don't survive. If your issue is that the baby wasn't fed enough, or you got a cold baby from outside and it's crashed, if that's all the issue was, most of those babies survive. If you have an infected kitten, or like the intestines, like malabsorption issues from not having mom's milk, those are the kittens that tend not to survive no matter what we do. So just keep in mind that sometimes no matter what we do, you can do everything right and they still don't survive. My vet always reminds me that even in like a controlled, humane breeding environment with purebred, fully vetted, every genetic condition is ruled out. Cats in a cattery that's perfectly maintained, still about 30% of kittens don't survive. So, and we're getting these filthy kittens from outside, from mud pits like my little black babies here came from, or flea infested environments, and they're coming in with URIs. The fact that we even have a 75% survival rate is amazing. So just keep that in mind. So fading kitten protocol basically is sugar and heat. And just remember, every 3 minutes for sugar. That's the biggest thing you can do, is every 3 minutes give them sugar. Does anyone have any questions about anything?
It's Riley. I have a quick question. It's not really about the fading kitten, but about probiotics. And, because they all start to have diarrhea at some point, it seems like.
Yeah.
When you say load up, like, is there a point where it's going to be too much or it's going to hurt them somehow? I mean, on the
I don't.
package, it'll say like every other day. And, it seems like when they really have diarrhea, they need it more than like at least once a day.
Yeah. I don't honestly know the answer to that. I use a lot more than the packages say,
Okay.
especially if there's diarrhea. And this holds true for some medications too, but when they have diarrhea and you give them probiotics, they're going to poop out probably 3/4 of that probiotic. It doesn't sit in the intestines for long enough to actually get used. So I do double and triple it when they have diarrhea.
Okay.
Or I'll use multiple different brands of probiotics.
Yeah, I kind of alternate back and forth feedings of adding like Fortiflor and Benebac.
Yeah.
But I'll do it multiple times in a day when they're really bad. And I just don't know if that's like, okay.
That's good.
Okay.
Yep.
Hello, it's Jennifer. I have a question. I have a heating pad, like an animal heating pad. And
Yeah.
you have like I think I could turn it all the way up to like 140 degrees or something.
Okay.
What would you suggest that temperature be on if it's like on the bottom?
On the bottom for like a normal kitten.
Yeah, like for a bottle feeder, like in the bottom of their little carrier crate or whatever I have them in there.
So my heat pad doesn't go up to a specific temperature. I just have a low and a high. But I would, there's no instructions on the heat pad.
It tells me to turn it up or turn it down. It doesn't
Oh my
suggest like what you should put it on for each animal. Like I got it on
Yeah.
Amazon. It's kind of cool that I can adjust the temperature by degree, but I just don't know what degree to put it at.
So I think, I don't have an answer to this either, but I think what I would probably do, guys, are you on video? I think what I would probably do is aim for like a normal mom temperature, which is up to 102.5 for mom cats. Some mom cats are a little warmer. But I think I would probably start around there since that's
Okay.
what the kittens are living with when they have a mom.
Okay, I just got it, so I haven't used it yet. So I was wondering before I used it. Like,
I think if it was me, that's what I would try first.
okay, thank you.
My incubators, for newborns, I usually do 95 to 100 degrees. So seems like it would be similar. Anything else? Fading kitten, honestly, I think a lot of people are super nervous of the whole process, but really it's truly as simple as just sugar and heat, sugar and heat. And you're gonna wanna keep checking. I wouldn't go more than about 10 minutes without checking a temperature. And every 3 minutes giving sugar.
I had a question. It was kind of based on some things that were also in the chat. So
Sure.
about, so good to be prepared with the Karo syrup and the dextrose, but like in an emergency, could you use molasses or like
Yep.
grape jelly or something like that?
So molasses, for sure, I've heard of people using that. If you have grape jelly or something like that, obviously you're gonna wanna make sure there's no xylitol or anything in it. The low
Nothing
sugar,
artificial. Yeah. Okay.
yeah, the low sugar versions of everything you're not gonna wanna use,
Mhm.
because obviously they don't have much sugar in them.
Right. Okay.
I've actually had someone use peanut butter once.
Oh yeah. I guess anything that's really concentrated with sugar in a pinch that doesn't have chunks
Yeah.
or anything in it. Yeah.
Right.
Okay. Thank you.
Ellie, this is Patty. I have another question about diarrhea. I
Sure.
know you and I have chatted on the side before, but when a kitten has chronic diarrhea, you sometimes use Metro.
Yes.
Um, and what amount do you suggest for kittens that are just, maybe 14 ounces or whatever? Because we have a lot of chronic diarrhea going on in the rescue with kittens.
Yeah. So it's a calculation based on their weight. So metronidazole, if you want, I can message you separately about this because it's a lot of math.
Okay.
But it depends on what concentration your liquid is that you have. With small kittens like that, they do have metronidazole, like those tiny tabs that are compounded. I wouldn't use tabs with a kitten that small, because Metro is one of the drugs that if you use too much of it, it can cause neurological issues. So you really want to be super accurate with it. But if you have a specific Metro that you keep on hand, I can kind of give you an idea of how much I can probably even make you like a weight chart for it.
Okay, and I do have some on hand, so we can chat on the side and I can get more information from you. Thank you.
Yeah. Yep. Any other questions?
To take a cat's sugar, do you use a regular glucose meter and do you just poke their paw like you would a human? Is it a
Yeah.
different or?
So I have two different meters I use, and I can send links for these two. I have an Alpha Track 2, which is specific for cats and dogs. It's supposed to be the most accurate for animals, but they're pretty expensive, and the strips are $1 each. So if you have a kitten that's crashing for 2 hours and you're checking it every 10 or 15 minutes, you can easily go through $30 worth of strips in a single night. So I use that, or there's a meter that I got at Walmart that is suggested in a lot of the feline diabetes groups, and it's very accurate for cats. It's meant for humans, but it's a much lower cost. I think it's about $9 for the meter and about $9 for a bottle of 50 strips. So yeah, you poke the paw. I usually use the big pad on younger kittens. For kittens that are over about a pound or two, you can poke the edge of the ear. There's good vessels up there. But usually the paw pads. Once in a while, if you have a really sick kitten, they get swollen in the feet and they can leak basically serum. So it can be hard to get blood from the paw pad. If that happens, you can use the ear. I can do a video on how to do that too if you want. And I'll send you guys a whole list of supplies that I keep on hand. I actually have a bag that I'm putting together right now because I know I've met with a lot of you guys in the Wilson parking lot with kittens, either to give fluids or B12 or check sugars or whatever we're doing. I always bring a bag with me with a glucose meter and a syringe full of sugar, fluids. I bring penicillin with me. So I have a bag I'm putting together with every little emergency supply you could possibly need. So I can put a list together for you guys.
And when is B12 necessary?
B12, so if you have a kitten that's lethargic for any reason at all, B12 is not going to hurt. It gives kittens energy. Same with humans. If you're deficient in B12, you're super tired. It can help with appetite. It helps a lot with GI issues. So if you have chronic diarrhea, that's a good time to start throwing B12 at them. And then anemia. It doesn't help with every type of anemia, but it definitely can help support making new blood cells. So I use it with anyone that's anemic. And then I usually will use just a drop for the tinier kittens, the bottle feeders. For kittens up to like 2 or 3 pounds, I'll use 0.1 mLs. If you give more than they need, just FYI, the pee is going to be red or pink. They pee it out. You can't, I mean, you probably could overdose if you really tried, but they just pee out any excess.
Hey, it's Candace. I had a question on that. So, are the B12, do they just generally get given with the subcutaneous fluids, or can you give them in the B12 in other ways?
You can do it either way. So, like I had a kitten last year, Victoria. A lot of you know Victoria. Oops. She had some GI issues, but she also had a heart issue. So, with heart issues, you don't want to give too much fluid because you can overload the heart. So I was giving her B12 using an insulin syringe, B12 on its own. But you can mix it. Actually, what I do when I have kittens that need penicillin and fluids and B12, I mix it all in the same syringe. Those can all go together. Not everything can go together though. And B12, I didn't talk about this, but for people who don't know specifically what B12 is, it's given sub-Q, so under the skin with a needle. If anyone needs injection teaching, I can do that too. But they also now make an oral B12. They're little crushable tabs, if I remember right. So that's something, if you're uncomfortable with giving injections, that's something to ask your vet about. I'm pretty sure it's still a prescription only item, but that's something to have on hand.
Is B12 something you have to get from your vet, or can that be ordered?
So you can get B12 complex from anywhere, from Amazon or like farm stores, which is fine to use, but the better version of it is the I don't know how to say it, cyanocobalamin, I think it is. I can spell it, I can't say it. So you want a specific type of B12, and that is only through the vet. But if you can only get something over the counter, if you don't have access to a vet for any reason, you can use B12 complex. Anything else?
What was the name of the over-the-counter blood glucose meter you said at the store that they said was the same?
Hang on. Where's my order? I'm gonna look up in my email what it's called. I just got it a few days ago. It is called the Rely On Premier Classic. So it's RELION. That's all one word. Premier Classic. And it's a blood glucose meter. And I ordered Rely on Premier blood glucose test strips. They come in bottles of 50, and it's $9 for the meter and $9 for a bottle of strips. And something else I didn't talk about. If you do get a meter, I was really surprised when I first started checking glucoses on these kittens. Not all of them have low sugar. Some of them are like, they should be, again, 80 to 120. Some of them are like 250 and up. If you see a high blood sugar, don't give sugar. High blood sugar can be from stress, or it can be from infection, usually bacterial if it's high. Viral infections tend to bring down the blood sugar. It's kind of interesting how they're opposite, but if you see a high blood sugar, that's another situation that I would suggest starting antibiotics if you have them on hand, or calling your vet or whoever you need to call at your rescue to get some antibiotics for your kitten.
If you didn't have a blood glucose meter and you were just trying the Karo syrup, is that like, so you could be actually doing damage? I mean, is it unusual for that sugar to be high?
I would say probably about 75% of the time that I've checked, it's usually low blood sugar. So it's not a whole lot that you're going to find high blood sugars, but if you're, I mean, I would still give Karo regardless.
Okay.
If you don't have a meter, you don't know what your sugar is, you're not going to do, I mean, you're going to have a super high blood sugar if it's high to begin with, but that's not going to cause harm short term.
Okay.
If you do get a meter and you find that your sugar is high, the benefit there is, you know, to focus on other things like warming your kitten and starting antibiotics. That's really the biggest benefit of having that.
I know you said Duralube for the thermometers. I've always used Vaseline. Is that still okay, or is it
Yeah,
not?
that's fine. I use Vaseline too. Any other questions? None? All right. I hope I didn't miss too many typed messages on here. I forgot there's written messages, but Dawn, I can probably do that. I never thought about doing that, but yeah, I can probably put some stuff together. Oh, I see all these messages. I'm gonna go through and answer some of these. Let's see. Dawn, you asked about, it says dark or light. I'm assuming that's about the Karo syrup. It's usually light. Kimberly Wallace. So Kimberly said young kittens sleep a lot. So how do you know it's lethargic? Sleeping a lot is okay. You'll know it's lethargic when you go in to interact with the kitten and they don't jump right up. Most kittens will, like at feeding times, they'll jump right up and they're looking and rooting for their meal. If you're not seeing them rooting around and waking up readily, and you're having to stimulate and really wake them up, I would consider that more lethargic. Jennifer, yes, the D50 is also every 3 minutes. Carly, for the penicillin through Rejoiceful, we don't keep it at the office for Rejoiceful. Most of the fosters that use it have it at home. It's about, I don't know, $8 or $10 at farm stores. I always have a ton on hand. I have a huge 500 ml bottle because it was the only bottle I could find last time I bought it. If you ever need it, call me. We can meet up. Name of the kitten formula. Liz, I use either Fox Valley or Breeder's Edge. Fox Valley is new to me. I'm loving it so far. I haven't had any problems with it. Breeder's Edge has been amazing also, and that's one of the most popular, it probably is the most popular formula I see in the orphan kitten groups on Facebook. I would not recommend using the liquid pre-made formulas because they all cause diarrhea, and diarrhea is a huge cause of death in kittens. What else can I answer? And you guys, I think most of you know I'm off work right now, so I'm available all the time. If you ever have a crashing kitten, you can message me. I will walk you through it.
Someone's asking about K&R. Emily, do you not recommend that?
It's, you know, the powder isn't horrible. I find that a lot of kittens get diarrhea on KMR. The liquid I would absolutely not use. The powder, I go back and forth with that. I find that they do better on Breeder's Edge or Fox Valley, but KMR is not a bad formula.
Where can you get Breeder's Edge or Fox Valley? Is that like on Amazon, or like the only stuff I ever see in our local pet stores is KMR or some other brand?
Fox Valley, I get on Squirrels and More, but you can also order directly from their website, and I think it is cheaper on their website. Breeder's Edge, I get on Revival Animal Health. And you can also get Breeder's Edge on Amazon, but I think it's cheaper at Revival.
Thank you.
Oh, Lauren says it's on Chewy too. I didn't know that.
Okay.
And Henry's Healthy Pet is cheaper shipping Fox Valley. Okay.
Do you reuse your tubes, like sterilize them and reuse them for another animal, or are they one animal only?
Actually, I have Dr. Brown's bags. So I sterilize my tubes in the microwave with Dr. Brown's bags. I got these, you can get them on Amazon. But I'll put up to like, I don't know, I sometimes have a full bag of tubes that are used that you put them in the microwave with some water in the bag. There's instructions on the bag. And most brands of tubes hold up to the microwave just fine. If you're using the purple ones, the clear purple tubes, forget what brand they are. Those ones, the ends of the tubes tend to melt in the microwave, not always, but sometimes. The green ones don't melt that I've seen so far. So I reuse mine.
Where do you find syringes that don't wash away the numbers? What brand? Because
Yeah.
every kind I've gotten, the numbers go away.
Yeah. I use Care Touch brand.
Care Touch.
And I haven't had that problem.
Okay.
I get mine on Amazon.
Oh, good.
Anything else?
Do you have a method to what fringe size you would use on a kitten, or is it just basic, like, you know, 5 fringe or for little ones, or?
For the syringe, I just use, oh my gosh, my cat
I mean,
has his
for
head
the
in bag.
tubes.
Oh, for the tubes, so preemies, if you're doing kittens, I would always use a 3.5 or a 4. Anything about, I would say, like 100-gram newborns and up to almost a pound. I usually use 5 French. Once you get above about 12 or 13 ounces, you can use a larger tube than a 5 French, but I find that they do fine with 5 French until weaning age. If you use a tube, I think I said this already, but if you use a tube that's too small, I know everyone worries about using a tube that's too big, but honestly, the smaller the tube, the scarier they are to me, because they can coil as you're putting them in. They're not stiff enough not to just coil up in the throat. So I try to use the biggest size that's comfortable for the kitten, which is mostly 5 French. If you're only gonna get one size, you can only buy one size for whatever reason, I would choose 5 French.
I have one more question about syringes.
Sure.
When they're still on a syringe, like they haven't quite gotten to the point where they can be on a bottle, like they're just starting to suck. Is there ever a time where it's like too fast for them to drink it down? Because I've had them latch on and some of them are real kind of smooth and it's like they drink the whole thing in 30 seconds.
Yeah.
Is that going to affect their, in their intestines or in their stomach at all?
It can, so if, the only time I really worry about that is if the formulas or the gruel is not warm enough, and then you can cause some cramping in the belly. Otherwise, if they take it that quick and they don't, get overwhelmed with how much liquid is in their mouths. Mostly it doesn't really cause any harm.
Okay.
What else? Oops, I'm looking for the messages. Where did it go? Chat. Liz, I can make a list of supplies and where to buy them. I'm gonna have more Zoom sessions. Uh-oh, my phone's down to 2%. So I'm gonna have more sessions, but they'll probably be about specific things. Like if anyone wants, I don't know, a bottle feeding session or specific conditions, cleft palates, whatever you guys want to talk about. I'm willing to do these whenever.
Thank you for that.
Any other questions? Dawn, I don't know how to access the recording.
So yeah, I have set it, this is Riley again. It's been recording the whole time, so I don't, we'll see what happens in the end. It's supposed to be saving to my computer right now. So as soon as
Okay.
I can figure it out, I'll post it or do whatever I can do with it.
Okay.
Okay.
Thank you, Emily. This is Lynn. That was really helpful.
No problem.
Yeah, thank you for doing this, Emily. Really, really helpful. Appreciate it.
You're welcome. If you guys think of any questions, you can private message me if you want or put it in the chat. No more questions? All right. If no more questions, I think I'm going to log off.
Okay, thank you again.
Thank
No
you.
problem.
Thank you so
Welcome.
much. Bye.
Bye.
Emily, I'm going to stop the recording now.
Okay.